Hand pain, important to know why you have it because it affects everything we do. We use our hands for opening jars, we use it to put away things, fine motor movement like crocheting, knitting, but also things like writing, which I don't think we do as much of nowadays, but definitely typing. It's important to know the cause of the hand pain so we know how to treat it. I'm Dr. Neha Banasali, a rheumatologist. I love talking about arthritis, inflammation, and lifestyle medicine. Let's look at different ways to approach it. The first thing I would look at is distribution of pain. Where is the pain in your hands? Is it hurting more along the wrist or is it the true hand? Now, if it's the hand, is it hurting, so over here in the wrist, is it hurting the knuckles, any of these 3 sets of knuckles? Is it hurting the thumb? There's so many different areas that it could hurt at, and it's important to find out because something that I treat as a rheumatologist, an autoimmune specialist, is arthritis. Now, we tend to be better at treating inflammatory arthritis than we do as degenerative arthritis because it's important to know the differences of whether you need to see a specialist for this or not. So how are we going to break it down? Well, degenerative arthritis is the kind of arthritis that we all get as we get older. For example, you've been crocheting for years at a time. Maybe it's the fact that you're right hand dominant and that hand has always been bothering you a little bit more. But we can all get arthritis and it can be at different parts of the body. Some people have it more in the hands, some people have it more in the hips or the shoulders or the knees. You hear of people getting hip replacements. It could really be anywhere, but it could also be in your hands. The most common places of having degenerative or osteoarthritis in the hands is actually, usually it's going to be the end knuckles, and it's also possible to get it at the base of the thumb. Those are the kind of more common areas, but you could also get it in the middle knuckles. So any of these places are possible if you have hand arthritis. Now, let's kind of think about how do you differentiate inflammatory arthritis like rheumatoid arthritis or psoriatic arthritis, things like that. Time of the day is important. Yes, you could wake up with stiffness in your joints and it could be either type of arthritis, degenerative arthritis or inflammatory, but it depends how long that stiffness lasts. If it's for a few minutes, you kind of shake it off after 5 to 10 minutes, it might just still be degenerative arthritis. But if it's going on for hours that you're really unable to kind of use your hands very well, then that could be a problem. Or something commonly I hear is because a lot of people travel far, when they have their hands on the steering wheel and they've been driving for a while, then all of a sudden it's really hard to have to kind of like peel their hands off the steering wheel to have them work well again. So these are kind of things where I look for long-term stiffness, and I'm starting to worry about inflammatory arthritis if that's the case. Now, where does rheumatoid arthritis come in? Well, it can hit kind of similar areas, but it definitely tends to hit more small joints, kind of in the middle knuckles here and the PIPs. So the PIPs, the MCPs, and the wrist are kind of common spots in the hand. Now, in the hand, it tends to be symmetrical. It could be in the feet and ankles. It can be all over your body. It's an inflammatory arthritis. Very different than degenerative or osteoarthritis. So degenerative osteoarthritis, usually you have that degeneration in that spot. It doesn't necessarily go everywhere else. But in something like inflammatory arthritis, like rheumatoid arthritis, it can be all over your body. It could affect your other joints. It could affect your skin, your eyes, your voice box, so many places. It's a systemic condition and you definitely want to see a specialist for that, like a rheumatologist. But if you have degenerative arthritis, you may still have to see a specialist, but hopefully you can take care of it on your own with some different type of treatments, which we're going to get to in a little bit. So we talked about distribution of pain, and now I also want to mention the second thing, which is what type of pain is it? We touched on this. Is it a pain or is it a stiffness? Because those can mean very different things. Not always easy to tell because sometimes you can be so stiff and painful at the same time that you're not sure which it is. But important to know, and important to know time of day. Is it worse in the morning? Is it worse in the evening? Degenerative arthritis tends to be worse with overuse, so end of the day. Or if you've been doing an activity that is really difficult and it's a lot of fine motor, it could be worse right after doing that activity. I'm not saying to stop doing all your fine motor, crocheting, knitting, typing, but you have to kind of keep in the back of your mind that might be what's bothering your hand arthritis. So we talked about distribution and what type of pain it is. Now, is there other features to the pain? Is there numbness? Is there tingling? Because that could mean you might have a nerve being pinched. And actually it's pretty common to get something called carpal tunnel syndrome, or even if the ulnar tunnel is affected. So the ulnar tunnel is going to be affected on the ulnar side, which is this side, and you can get numbness on this side of the hand. or carpal tunnel, which is much more common, especially with the typing and not having good ergonomics, not sitting well, seat support, all of that. You could get carpal tunnel, and what that is, it is numbness and tingling kind of in the first 3 fingers and a little bit of maybe your 4th finger. So pay attention. If you have numbness and tingling, what side of the hand is it on? When does it bother you? This can often be a problem at nighttime. You don't realize it, but you're bending your hand like this, and that's kind of compromising the median nerve that's going in over here. You're kind of pinching it, and you start getting these numbness and tingling symptoms. So carpal tunnel could be it, or other nerve issues. Maybe it's not arthritis. Maybe it's more of a neuropathy. Next, do you notice any change in your hands? Are you noticing deformities? Deformities meaning, is it changing? Is the shape of the bone changing? For osteoarthritis, which is degenerative arthritis, we often see some changes here at the end, the distal phalangeal joints. So the distal means at the end, and that's where we kind of see these little knobby things, and people hate it. They're like, my hands are changing, I'm looking deformed. No, that's not the case, and you will not have a deforming arthritis, but it will give you some areas which maybe look a little bigger than others. You can also get it at the middle knuckles, and sometimes rings are hard. I was buying a new ring, and I was still already thinking, I'm a rheumatologist, and I know that the knuckles are gonna kind of get big in between, and I was like, maybe I should go for a bigger size, but then it's gonna go back and forth. The things you gotta think about as you get older. But yes, your knuckles can get a little bigger, and therefore rings may be a problem, and some people have had to have them cut off. So keep that in the back of your mind. It's not something you can do or not do when you get this bony overgrowth, which is what we think of with degenerative arthritis, but it's something that we have to deal with. So extra bone formation is the way you think about it with degenerative arthritis. And that's why when we consider injecting it sometimes, there is extra bone there. So there's not a lot of space for us to go in to inject those certain joints. And we do it sometimes if we have to, but it can be a little bit painful because of all this extra bone in that area. Distribution, we talked about the type of pain, we've talked about whether there's other features like numbness or tingling, and deformities, or a difference in appearance in the different joints. Also, I want you to think about what brings it on. Is it the weather? The weather changing definitely affects it. Well, then more likely it could be degenerative arthritis, although we do see that in inflammatory arthritis as well. And the thing is, if you have inflammatory arthritis, like rheumatoid arthritis, psoriatic arthritis, then I want you to definitely think about the fact that those different areas, yes, you may be taking medication, it may be in remission, but you might have some degeneration there because of the activity against those areas that you had before. So it's important, to know that you can get this secondary arthritis in those areas as well. Food. Does food trigger your pain? This is really important because it could be that you don't have osteoarthritis or you don't have rheumatoid arthritis, and it could also be something called gout or gouty arthritis. And yes, you can get it in your hands. A lot of people think it's just the big toe, but you can get it in your hands. Women can get it too, usually after menopause. It's not something we commonly see before menopause, unless there's some genetic issues, but we definitely can see it after menopause in the hands in women as well. So something to keep in the back of your mind. And even if it's not gout, some people do have dietary triggers. For example, if they're gluten sensitive and they eat a big meal, cheesy pizza or something to that effect, and that could bother their joints as well. Even people who may drink some wine and they don't necessarily have gout, but that could trigger some pain in their joints. So it's important to know the associations. And in case you go see an autoimmune specialist or your physician, then they're gonna ask you these questions. So it's good to know in the back of your mind, what are the different facets around your pain? When does it happen? What time of day? What type of pain? Where's the distribution? What brings it on? What makes it better? Because I don't want you to have a wasted visit to the doctor's office. If you're going to go, it's good to have this information before you go so you can talk about what are the different solutions. If you do have arthritis, what's our goal here? Our goal is to improve the function, decrease the pain, and overall get you moving and healthy, right? And there's a few different ways to do this. The first thing I would suggest, if you haven't done it already, is something called occupational therapy, which is basically physical therapy, but for the hands. And so it's usually a different person. They go and they teach you exercises for these muscles here. How sometimes it's about teaching you different ways to open jars and maybe different tools you can use, but also the muscle strengthening is really helpful. And as people get older, oftentimes the muscles are not as good. Pay attention if you're having something called atrophy here. That means that even though it's not bothering you that much, you're noticing this change in your hand and you're losing muscle there. So you should probably go do some therapy. You can even do some online exercises. There's also apps out there for that. But it's a good idea to see if you could improve the muscle strength in your hands. People think about it other places of the body, the knees, the hips, but also the hands. What else can we do for it? Well, we could give you topical gels, and a lot of them are over the counter, whether it's ibuprofen, anti-inflammatory type of gels like Voltaren gel, or there's BioFreeze, some people like to use that, blue emu oil. These are all different things you can use, Tiger Balm, and a lot of it is just removing the pain. You can apply it, let it dry, and the other thing you can do is put on a splint. Now the splints can be very helpful, so it depends kind of what the reason is. So I said I was going to come back to this, and what I wanted to talk about was thumb arthritis, base of the thumb, which is really, really common with osteoarthritis. So basically what it is that you get squaring of this joint over here as you kind of progress over time. Not everybody gets it. And interestingly enough, some people who have very squared hands didn't necessarily have pain when that was happening, and some people who you can barely see the difference have a lot of pain. We don't know who's going to get the pain and who's not going to get the pain, but it hurts when you have it. And if you do have it, you can apply the gel, you can try splinting. If you're going to do splinting, it's helpful to do it during the day when you're doing this overuse motion. Even opening a door, cutting vegetables, you're using this and it is being irritated. So that's when you kind of want to wear a splint, which is not always easy to do because you want to do all these activities and it kind of impedes you. There are several different kinds of splints out there. And I want to say this is kind of like Goldilocks. You don't want to necessarily get the splint that's too short, that's not really giving you this protection at the thumb joint. You don't want to get the one that's too long because then you can't really do a lot of things. Maybe the one in the middle might be best for you. But a lot of people have more than one type of brace because they use it at different times. Sometimes they just need to use their hand more, but they know it's going to hurt them, so they may wear a smaller one. And other times it's okay if they're wearing the larger one. They're not doing those type of activities and they really want to it's been hurting a lot and they really want to improve it. So you could use the longer one. Carpal tunnel syndrome, we tend to suggest wearing the bracing at nighttime, so you're not really doing this movement to compress the nerve over here. So it does depend on what you have and therefore which bracing and what time of day or night to wear it. You can definitely use over-the-counter medications, whether it's anti-inflammatories, Tylenol, Tylenol arthritis, acetaminophen. There's so many medications out there, but a lot of them do have potential side effects, and sometimes they're not enough. You can also use supplements like curcumin, turmeric, ginger if you need to as a spice. A lot of these things, it's called having a toolbox. You'll know when you have severe pain what to take versus mild pain and moderate pain. And sometimes you may have a lot of different treatments that you need available to you when you have this pain. Third thing I would say, so if you're doing the topicals and they're not helping, you can even put on the little fingers here sometimes if you have a really severely painful area, is that we can inject it. And like I said before, it is painful to inject in these little areas because it's bony overgrowth. There's not much area to go in and it's a tiny area. So while we easily will inject bursitis, in the hips, and we do the knees a lot, we do the shoulders a lot, and they don't hurt as much. But this area, I will say, is a little bit more painful because it's so tiny. But you can do it if you need to do it. I have done it in the DIP joints as well, the distal ones. Try not to do that because it does hurt, but sometimes you have no choice, it's really inflamed. You can go to your friendly orthopedic surgeon and have it looked at, or your rheumatologist. You could try surgery. Generally it's last, and when do you do surgery? You don't jump to surgery. You do it when everything else has failed and you're avoiding doing activities that you should be doing, but you're not doing them because of your pain. Surgeons also don't want to do it unless there's a lack of function, because it is kind of a little bit long as a recovery time and you can't use the side. Oftentimes it's in the dominant hand, so it can be tough to do the surgery, but I have seen amazing results from it. So if you need to have it done, it's good to get an evaluation to see if you're a good candidate. So we've talked about mostly arthritis. We've also talked about neuropathies, different things like gout, but there are other things. If you had fallen and your outstretched hand, you could also tear something. So some people go in and they get an x-ray after a fall, but it also could be a ligament tear, and that could be just nagging at you and causing pain. Another reason to see a hand specialist. But also something like gamer's thumb, which you're just doing a lot of overuse, can cause arthritis, and you may want to rest. So the solution for this, so I've talked about lots of different solutions for this, but ultimately we want you to use your joints. People with rheumatoid arthritis, severe rheumatoid arthritis, they may have osteoarthritis as well, but they're still doing those fine motor movements with their fingers and using them as best as they can. And that's really what the ultimate goal is over here. So definitely, if you have pain, rest the joints. Use them as you can. Try to strengthen them. Overall, do exercise, eat well, move, and de-stress. These are things that are going to help you regardless of whether you have arthritis in your hands or elsewhere in your body or any other health condition. If you enjoyed this video on hand pain and the different causes, then please hit the like button and subscribe so that you can see these videos right away when they come out, and we can continue talking about health, wellness, how to live your best life with lifestyle medicine.